There are two things that distort our view of reality so that we don't get feedback, so we don't make changes. One's our ego. The other is all the people that enable us. It's when somebody puts a pillow under my butt right before I fall, every time. I came in as a leader of a clinic system, and our chief medical officer came out. We had a new electronic health record, and he said, we have all this big data, let's use it to help our patients. And he came out, he noticed with the big data that we could actually figure out the people who had diabetes, and that we could do some things as a health system like outward bound calling to make sure that we checked in with the patient. And at the time, this was revolutionary. We would call out, we'd ask them if they got community resources, we'd get them in the clinic to be seen on a regular basis because we knew the evidence said that would increase their health status. So I went out and I said, you guys, this is so amazing. Isn't he a genius? He's going to use data and we get to call people and it'll be awesome, and then we'll help the patients that we want to serve. Now, a lot of people went, that is a good idea, and they started changing the way they worked as nurses to do outbound calling. One nurse is like, I ain't no telemarketer, and I didn't sign up to do outbound calling, and my doctor says I don't have to. I'm like, wow, she's very confident. So I thought, no problem, I'll just show her the org chart and she'll see that she doesn't work for the doctor because he works for me too. And then it'll just be so clear, and then she'll go, I'm so sorry, I didn't understand. So I showed her the org chart, and I go, I just want to clarify that you really work for us in the health system, and we're not asking you to do anything immoral, illegal. It's based on best practice, it's evidence-based, that's all we're asking. She stuck with it, not gonna do it. So I did the arm around, and I did more coaching, and I was just helping her figure out whether she could get on board or leave the organization. At the same time, this physician was zero compliant in this initiative. So the CMO called a meeting, and he wanted me to report on how we were doing. So I prepared the data, and Dr. Smith, we'll call him, had zero compliance. Okay. And I'm transparent. I went out to all my docs and I said, here is what I'm reporting tomorrow to Steve. And Dr. Smith didn't care. He just looked at it, he goes, you're right, I think it's a dumb initiative. I go, that's fine. I'm not the boss of you in this way. I can't manage your clinical practice. I'm not a doctor. So I'm heading in to meet with Steve, and my phone starts buzzing. It's Dr. Smith. And I'm really optimistic. I'm like, oh my God, I think we had a breakthrough. He's calling me. This never happened. He usually avoids me. But I couldn't take the message. So I go in, I meet with Steve. I call Dr. Smith after the meeting. I said, Dr. Smith, what's up? He goes, did you meet with Steve today? I go, I did. He goes, did you show him the chart you showed me with me being zero compliant? I go, I did. He goes, well, did you tell him that I also see the highest number of patients in the clinic? I said, no, we weren't talking about throughput. He goes, well, did you tell him that my patients have the highest acuity level in the clinic? And I wanted to say, that's because you don't manage diabetes, but, right? It's like, but I'm like, I go, we weren't talking about acuity levels. He goes, are you kidding me? He goes, I bet Steve was mad. I go, he looked furious. He goes, I better call him. I go, he said he'd be calling you. We hung up the phone, and here's what I realized. For 20 years, whenever that man hadn't complied with something, someone put an asterisk by his name. Well, he's zero compliance here. Let me tell you about in 1985, he once saved a kid, doing a trachea with a ballpoint pen. Okay. And so what I mean by enabling is all the times we protect people from their own data, we protect them not from our feedback, but from the feedback of the marketplace, the feedback of the people that work with them. We protect them by putting asterisks by their names. And I was neutral. I wasn't retaliatory. I was just neutral. I removed all the asterisks from people's names. Let's have some transparency here. And I'm here to help you. If you want to sign up, I'm your girl. If you don't, I want you to start to think about the many ways we enable folks by protecting them from reality.